Hello everyone, I am Dr. Farah Ingale, Senior Consultant Physician and Diabetologist and also Director Internal Medicine, Fortis Hiranandani Hospital, Vashi, Navi Mumbai. Today I am going to speak before you on the myths and facts about Omicron, the COVID-19 variant. Delta wave affected more of middle-aged people, and we had seen lot of mortality and morbidity because of delta waves, where number of people died mainly between the ages of 35 to 45. This wave also lasted for about 2 months. Then there was a lull. The cases started declining and everyone thought that the pandemic is about to get over. Then suddenly the number of cases started to rise. It's nearly about a month, it's not even a month completed, that we had seen a rise in the number of cases, and this time the number of cases have far exceeded the cases that we have seen in the second wave of Delta infection. This Omicron virus had been reported from South Africa. It is a lab proven virus. It is the genomic sequencing proven virus, so it's for sure. But then, because it has, the number of cases have suddenly gone up and it is winter season, and because the number of cases had come down, everyone thought that the pandemic is going to end. And then everyone thought that the myth here was, everyone thought that it is a farce created by the social media. Because it is winter time anyways, everyone gets cough and cold and they suffer minor infections and become all right. Omicron presentation is also a milder type till now. In Omicron infection also, like in any common cold and flu, we get mild fever, upper respiratory problems like sore throat, mild sneezing, mild running nose and mild cough. This virus mainly affects the upper respiratory tract. The Omicron variant so far has not caused serious diseases or has not badly involved the lungs. So everyone thought that it is a farce and it's only common cold, but people are labeling, especially the social media is labeling it as a viral Omicron variant, but that's not true. As I've said, it has already been proven in the laboratories after the genomic sequencing, and it is true that this is Omicron variant which is affecting the human these days, and it is too early to say whether it will remain like this or it's going to turn into a serious case or serious disease, because it's not even 3 months since we are facing Omicron, and the virus, as it undergoes mutation, may change into a more virulent form. Then the second myth is that Omicron, being a minor infection, does not require hospitalizations, or we should not take it that seriously. That's again not true, because the occupancy in the hospitals before the Omicron struck had come very low. It was like about 10% of the beds, not even 10% were occupied by COVID patients. But as the Omicron cases started coming in, the hospital beds were all occupied. The non-COVID beds had to be converted to COVID beds, and people were not getting beds anywhere. So it was like the first wave and like the Delta wave. Number of oxygen beds had also gone up by 20%, and this is in spite of the vaccination being done. India had completed about 60 to 70% of vaccination doses, both 2 doses. Other countries in the world like Israel had even given the booster doses to the population. In fact, there the people had received 4 doses, and still the Omicron cases are at its highest, and there are no beds available anywhere in the world in any hospital you take. So it's not that it is just a minor infection. People were not required hospitalization is a myth. In fact, we are seeing patients getting admitted, some of them even requiring oxygen, and some of them even succumbing, especially those who have comorbidities. Though the death rate this time is less, it's only 0.1, but you never know, you can be amongst the 0.1% of the cases. That's why I request each one of you to follow COVID appropriate behavior properly, mask yourself properly, and it has to be a proper masking, preferably double mask. It has to be worn properly, like it should cover the bridge of the nose to below the chin and on the sides tightly. Then you have to maintain a social distance of 6 feet, which is 2 meters, and use hand sanitizer whenever you touch any surfaces. And also we need to ramp up the vaccination. So if you follow COVID appropriate behavior and if you ramp up vaccination, both together, if done quickly, will help in breaking the chain and will prevent transmission of infection, and that is how we can all come together and help to end the pandemic. Thank you so much.